Linda Fagan, certified family nurse practitioner and family practitioner MD. Been in practice for over 25 years and doing family practice.
Okay.
And I'm also a psychologist too.
Okay. Can you explain the prenatal process from the time of conception to the time of delivery?
The most important thing about the prenatal process is good health care. In the first 3 months of the trimesters of the first 9 months, it's very important that you have good nutrition because the formation of the heart, the brain, the spinal column, all it comes into play then, along with the organs, etc. And the blood system, the circulation, but most important is being in good nutritional health while in prenatal.
What prenatal measures must a pregnant woman take to make sure her baby is healthy?
Folic acid is a very important thing to take. Folic acid helps with the neurological development of the spine and the neural system. They find that if there's anything neurologically like cerebral palsy, etc., it's because of lack of folic acid a lot of times, so it's usually supplemented. Prenatal vitamins are really important, staying away from a lot of caffeine, not smoking, alcohol, staying within the confines of eating good nutrition, protein, carbohydrates, and fats, and not overeating and overdoing it. Most important too is exercise during prenatal stages.
Okay, so what are the effects of a fetus when the mother smokes during the pregnancy?
For the mother is dangerous and for the babies too. Mother smoking and low weight babies.
Hi, my name is Marianne Garcia. I'm a registered nurse here at Altus Home Health Services.
Okay, and my name is Jasenia, and I came here to ask you a few questions about women smoking while being pregnant. Do you think it's possible for a woman to actually stop smoking while being pregnant?
I think that it's something that may be difficult, but absolutely possible, especially when you consider the risks involved and how it can harm your baby. Some 5 tips on quitting while smoking are: plan ahead. 2, get support from people around you. Talk to your doctor about quitting. Keep reminding yourself why you're quitting, and don't give up.
Okay, and what could be one long-term effect on the baby after being born?
There's several risk factors. There's many risk factors involved with smoking while pregnant. One is that the baby can have low birth weight. The baby you can miscarry more easily. The baby can be born still. A long-term effect, it can also be asthma or other lung respiratory disorders.
Do you think that it's possible for the baby to get all their nutrients
while smoking? What I think when the woman is smoking, that the nicotine and the carbon monoxide and the harmful poisons that are in the cigarettes are inhaled and carried through the bloodstream, and it's bloodstream that it's shared with the baby, and that can lower the oxygen level of the baby into the baby's brain. So absolutely it can be harmful to the baby.
Okay, thank you.
You're welcome.
What are some effects of smoking while pregnant?
Oh, smallness of the baby, growth factors. The baby will develop respiratory problems and the baby won't grow properly. It actually will stunt the growth process too. Lung wise, the baby will probably come out with measures like a lot of upper respiratory infections and asthma, and could come out premature because of smoking.
And what are some tips that you can give us to quit smoking, especially while pregnant?
Doing something orally, like smoking is a gratification kind of thing. A lot of people don't believe in hypnotizing. Hypnotizing is a good thing. They do classes on hypnotizing people for smoking. Also, keeping something in your mouth. It's possible, like a lollipop or a lifesaver or something that helps as far as putting something to your mouth back and forth.
Okay. Do you think the patches and any oral medication like Chantix can help? Or is it safe for the baby?
I don't think it's safe. I wouldn't take any chances with those kind of thing when you're pregnant, especially if you're trying to do a healthy environment. I think, because there's another human being and there's so many things going on so rapid and so fast inside the body that it might affect it, and I wouldn't recommend it to anybody.
Okay. Do you think it's important to have a good support system around you while trying to quit smoking when you're pregnant?
Absolutely, but not ridiculing people who smoke, not badgering them all the time about smoking this and smoking that. It'll make them crave it even more. You have to find some supportive method that will help them to quit. And not being around anybody who smokes either is another thing. You don't want secondhand smoke. Even though somebody quits, the other person, whether it be the spouse or anybody else, avoiding somebody else smoking and being in a smoke-filled room is important too.
Does secondhand smoke affect the baby as if you're smoking it yourself?
Yes. Yes.
Okay.
Absolutely. Yes.
Okay. Thank you for your time, Dr. Fagan.
You're welcome.
I really appreciate it.
Anytime.